Did you know that every 5 seconds someone chokes on food, leading to potential airway obstruction? This startling statistic highlights a critical issue that affects countless lives. In today's video, we'll explore the causes, prevention, and life-saving techniques you need to know to protect yourself and your loved ones. Stay tuned. Airway support is crucial in emergency situations, and knowing how to respond can make all the difference between life and death. When someone is choking or experiencing an airway obstruction, time is of the essence. Knowing basic life support, or BLS, is vital for everyone as it equips you with the skills to respond effectively in emergencies, especially those involving airway issues. In situations like choking or respiratory arrest, quick action can mean the difference between life and death. BLS training teaches you how to recognize critical signs, perform chest compressions, and provide rescue breaths, all essential techniques to help clear an obstruction and restore breathing. By learning these life-saving skills, you become part of a crucial network of responders, ready to help friends, family, and even strangers when they need it most. So, let's explore how mastering BLS can prepare you to make a real difference in urgent situations. Choking incidents are more common than you might think, with thousands of people affected every year. In fact, choking is one of the leading causes of accidental death, particularly among children and the elderly. When someone can't breathe, every second counts. Their brain and vital organs can begin to suffer damage within just a few minutes. The urgency of responding quickly cannot be overstated. If a person is unable to breathe, they may lose consciousness within moments, making immediate action critical. Knowing the signs of choking and how to respond can save lives. It's essential to stay calm, act swiftly, and use the appropriate techniques to clear the airway. In this video, we'll dive deeper into these statistics, share real-life stories, and emphasize the importance of being prepared to help in these high-stakes situations. Airway issues refer to any condition that disrupts the normal flow of air into and out of the lungs. The most common types include choking, which occurs when an object such as food or a small toy becomes lodged in the throat or windpipe, blocking airflow. Choking can lead to a complete inability to breathe, cough, or speak. Obstructed airway is a broader term that encompasses any blockage that impairs breathing. It can be caused by choking, swelling from an allergic reaction, infections like croup, or even medical conditions such as asthma. Recognizing the signs of airway issues, such as difficulty breathing, wheezing, or the inability to talk, can be life-saving. Understanding these conditions helps prepare us to act quickly and effectively in emergencies. Airway issues can arise from various common causes, including food. This is the leading cause of choking, especially in children and older adults. Foods like hot dogs, nuts, grapes, and pieces of meat can easily become lodged in the throat if not chewed properly. Objects. Small items such as coins, toys, or household items can pose significant risks, particularly for young children who might put things in their mouths. Even adults can accidentally choke on objects while eating or talking. Medical conditions. Certain medical conditions can contribute to airway obstruction. Allergic reactions can cause swelling in the throat, known as anaphylaxis, while respiratory conditions like asthma or chronic obstructive pulmonary disease, or COPD, can lead to airway constriction. Additionally, conditions such as sleep apnea can result in temporary airway blockages during sleep. Recognizing the signs of airway obstruction is crucial for timely intervention. Here are some key indicators. Inability to speak. If someone is unable to talk or make sounds, it may indicate that their airway is severely obstructed. This is a critical sign that immediate action is needed. Coughing. While a person may cough to try to clear their airway, persistent or ineffective coughing can suggest that something is stuck. If they are coughing but struggling to breathe, this is a warning sign. Distress. Look for signs of panic or distress. The person may grasp their throat, widen their eyes, or exhibit signs of anxiety. They might also display difficulty breathing, with rapid labored breaths or a bluish tint around the lips or fingertips. When approaching a person in distress due to an airway obstruction, it's essential to stay calm and act swiftly. Here's how to do it. Assess the situation. Quickly observe the person. Are they able to cough, speak, or breathe? If they can still cough or speak, encourage them to keep coughing to try to dislodge the obstruction. Introduce yourself. If the person is conscious and aware, calmly introduce yourself. Reassure them that you're there to help. Ask questions. If possible, ask simple questions like, are you choking or can you breathe? This helps you gauge the severity of the situation. If they nod but cannot speak, it's a clear sign they need help. Call for help. If the situation seems severe or the person is unable to breathe, shout for help or call emergency services immediately. Quick assistance can be crucial. Positioning. If the person is unable to breathe, guide them to a safe area where they can receive help. If they are conscious, have them lean forward slightly, which can help gravity assist in dislodging the object. Prepare to act. If the person is unable to cough or breathe, be ready to perform the Heimlich maneuver, also known as abdominal thrusts or CPR if they lose consciousness. Make sure you know how to execute these techniques properly before you begin. By approaching the situation calmly and confidently, you can provide critical support in a time of need. Before you assist someone in distress, it's vital to ensure your own safety first. Here's why. Assess the environment. Quickly evaluate your surroundings. If the situation poses a risk to you, such as being in a crowded area or near potential hazards, you may need to reposition yourself or create space. Protect yourself from aggressive responses. A person in distress may react unpredictably. If they're panicking or struggling, they might inadvertently push or hit you. Ensuring you're at a safe distance can prevent injury. Call for help. If the situation is serious, call for emergency assistance before approaching the individual. This ensures that trained professionals are on the way and you can focus on providing immediate help. Stay calm. Your composure can influence the person in distress. If you're calm and collected, it helps to reassure them and can lead to a more effective response. When assessing whether someone is choking, both verbal cues and non-verbal signs play an essential role. Here's how to approach it. Verbal cues. Directly ask. If the person is conscious and able to respond, calmly ask, are you choking or can you breathe? This straightforward question can help gauge their condition, encourage responses. If they can nod or shake their head, it provides quick feedback. You can follow up with, if you can't speak, give me a thumbs up or down. Non-verbal signs, gestures, pay attention to their body language. If they are clutching their throat, this is a strong indicator that they may be choking. Facial expressions, look for signs of distress or panic. Wide eyes, a flushed face, or a look of confusion can suggest they're struggling to breathe. Breathing difficulty. Notice if they are making wheezing sounds or struggling to catch their breath. These are crucial signs that they need immediate assistance. Coughing. If they are coughing but struggling to get air, this indicates a partial obstruction. Encourage them to keep coughing if they can. By using both verbal and non-verbal cues, you can quickly assess the situation and determine the best course of action to assist the person effectively. Knowing when to call emergency services is crucial in a choking situation. Here's when you should do so. When to call for help. Unresponsive. If the person becomes unresponsive, meaning they are not breathing, do not have a pulse, or cannot be awakened, immediately call emergency services. This is critical, as they require immediate medical intervention. Severe difficulty breathing. If the person is showing signs of extreme distress and is struggling to breathe, even if they are still conscious, it's essential to call for help. This can include wheezing, gasping, or having blue-tinged lips or fingertips. Ineffective coughing. If the person is unable to cough effectively or is making no sound while trying to breathe, this indicates a severe airway obstruction. Calling emergency services at this point is vital. Loss of consciousness. If they lose consciousness, you should call for help right away and begin CPR if you're trained to do so. After initial attempts fail, if you've attempted to dislodge the obstruction using the Heimlich maneuver or other techniques without success, do not hesitate to call emergency services for further assistance. How to call for help. Provide clear information. When you call, clearly state your location, the nature of the emergency, and describe the situation concisely. Stay on the line, remain on the call and follow any instructions given by the operator until help arrives. They may provide critical advice on what to do next. By knowing when to call emergency services, you can ensure that the person in distress receives the timely help they need. All right, let's go through the steps to perform abdominal thrusts, also known as the Heimlich maneuver. First, assess the situation. Ensure the person is indeed choking and unable to breathe or speak. If they are conscious but struggling, you can proceed. Position yourself by standing behind the person. If they're sitting, you can do this from their side or slightly behind. If they're standing, ensure you have enough space. Next, make a fist with one hand. Place the thumb side of your fist just above the person's navel or belly button. Use your other hand to grasp your fist. Now perform quick upward thrusts. Using your abdominal muscles, thrust your hands inward and upward. Think of it as a quick upward motion towards the diaphragm. Continue thrusting until the object is dislodged or the person becomes unresponsive. A few key points to remember. Do not hit the back. Unlike some techniques, do not pat the person on the back while performing abdominal thrusts, as this can push the object further down. If the person is significantly larger than you, you may need to position yourself differently or consider using a chair or another surface for better leverage. If at any point the person loses consciousness, gently lower them to the ground and begin CPR while calling for emergency services. Practicing these steps and ensuring proper hand placement can help you respond effectively in a choking emergency. Let's break down the thrusting motion. Start with your hands placed correctly just above the person's navel with your fist held firmly. Before you begin the thrusts, engage your abdominal muscles. This will give you the power needed to create an effective upward thrust. The thrust should be both inward and upward. Imagine you are trying to lift the person's diaphragm. Use a quick, forceful motion. You want to apply enough pressure to generate a strong thrust, but be cautious not to use excessive force that could cause injury. If the obstruction is not cleared after the first thrust, repeat the motion. Typically, 5 to 10 thrusts are recommended, but continue until the object is dislodged or the person becomes unresponsive. After each thrust, observe the person's condition. If they are able to cough, speak or breathe, encourage them to keep coughing. Some key tips. The thrusts should be quick and deliberate. Avoid slow or jerky movements as they may not generate the needed force. Keep your focus on the person's condition throughout the process, ready to adjust your approach if needed. When performing the Heimlich maneuver, or abdominal thrusts, it's important to adapt your technique based on the age and size of the person in distress. Here are the key differences for adults and children. For adults, place your fist just above the navel or belly button. Use a firm, quick inward and upward thrust to create sufficient pressure to dislodge the obstruction. This is typically performed while the person is standing or sitting. For children ages 1 to 8, you can still use the Heimlich maneuver, but if the child is smaller, you may place your fist slightly lower, just above the belly button. Use gentler thrusts compared to adults. The motion should still be inward and upward, but should be adapted to avoid injury. If the child is sitting, it can be helpful to kneel down beside them to maintain better control. For infants under 1 year, do not perform abdominal thrusts. Instead, alternate between back blows and chest thrusts. Hold the infant face down on your forearm, supporting their head and neck. Give up to 5 firm back blows between the shoulder blades with the heel of your hand. If the obstruction isn't cleared, turn the infant onto their back and perform 5 chest thrusts using 2 fingers in the center of the chest, just below the nipple line. Always adjust your technique based on the person's age and size to ensure safety and effectiveness. Stay calm and focused to provide the best care in an emergency situation. Here's how to correctly deliver back blows for both children and infants in a choking emergency. Back blows for children, ages 1 to 8, position the child. Have the child lean forward slightly, ideally resting on your forearm. Stand or kneel behind them for better support and control. Deliver back blows. Use the heel of your hand to deliver firm blows to the middle of the back, between the shoulder blades. Aim for a total of up to 5 blows, using enough force to help dislodge the obstruction, but not so much that it causes injury. Reassess after the back blows. Check if the child is able to cough or breathe. If not, you may need to perform abdominal thrusts or repeat the back blows if they remain conscious. Back blows for infants under 1 year. Position the infant. Sit down and hold the infant face down on your forearm, supporting their head and neck with your hand. Ensure the infant's head is lower than their chest. Deliver back blows. Use the heel of your hand to deliver up to 5 firm back blows between the infant's shoulder blades. Keep the blows firm but gentle enough to avoid causing harm. Reassess. After delivering the back blows, check if the infant is able to cough or breathe. If the obstruction is not cleared, you will need to proceed to chest thrusts. Important considerations. Stay calm. Keep your composure to reassure the child or infant. Monitor response. Always assess their response after each set of blows. If they start to breathe or cough effectively, encourage them to continue. Seek help. If the obstruction does not clear, call emergency services if you haven't already. Using these techniques appropriately can help you respond effectively in choking emergencies for both children and infants. Here's how to position a child or infant correctly during a choking emergency. Positioning a child, ages 1 to 8, leaning forward. Have the child stand or sit slightly leaning forward. This position allows gravity to assist in dislodging the obstruction. Support. You can position yourself behind the child, providing support by placing one arm around their back to help keep them steady, ready for back blows. Ensure they are in a position where you can easily reach their back to deliver firm back blows. If necessary, kneel or crouch to get to the right height. Positioning an infant under 1 year, face down on forearm. Sit down and place the infant face down on your forearm. Ensure their head is lower than their chest to allow gravity to help dislodge any obstruction. Supporting the head and neck. Use your hand to support the infant's head and neck. Make sure their chin is resting on your forearm and their body is supported by your arm. Ready for back blows. With the infant securely positioned, use the heel of your hand to deliver back blows between the shoulder blades. General considerations. Stay calm. Maintaining a calm demeanor is crucial, as it helps to reassure the child or infant during a distressing situation. Reassess frequently. After each set of back blows, check if the obstruction has cleared and if the child or infant can cough or breathe. By positioning the child or infant correctly, you maximize the effectiveness of your interventions and increase the chances of successfully dislodging the obstruction. Checking if a person is breathing and responsive is a crucial step in assessing their condition, especially in emergencies. Here's how to do it effectively. Steps to check for breathing and responsiveness. Approach calmly. Ensure the scene is safe for you to approach the person. Assess responsiveness. Gently shake. If the person is unconscious, gently shake their shoulders and shout, "Are you okay?" Check for movement. Look for any response such as eye movement or verbal replies. Call for help. If the person is unresponsive, call emergency services immediately. Check for breathing, positioning. If the person is lying down, position yourself next to them. Look, listen, feel, look. Observe the person's chest for rising and falling. Listen, place your ear near their mouth and nose to hear any sounds of breathing. Feel, place your hand on their chest to feel for breaths. Duration. Perform this check for no longer than 10 seconds. Signs of breathing. Normal breathing will appear smooth and regular. If the person is breathing, you may hear sounds like normal inhalation and exhalation. If the person is not breathing or you are unsure, begin CPR immediately and continue until help arrives or the person becomes responsive. Key points. Stay calm. Your calm demeanor can help you think clearly and reassure others around you. Quick assessment. Time is critical. Act quickly but methodically to assess the situation. Prioritize safety. Always ensure that it's safe to approach the person before checking their responsiveness and breathing. By following these steps, you can effectively assess whether someone is breathing and responsive, enabling you to provide the necessary assistance. If a person becomes unresponsive and is not breathing, performing CPR or cardiopulmonary resuscitation is essential. Here's a brief overview of how to do it. Steps to perform CPR: call for help. If you haven't already, call emergency services or ask someone else to do so while you begin CPR. Position the person. Ensure the person is lying flat on their back on a firm surface. Check for responsiveness. Gently shake their shoulders and shout, "Are you okay?" If there's no response, proceed to CPR. Open the airway. Tilt the head back slightly by placing one hand on the forehead and the other under the chin, lifting the chin to open the airway. Check for breathing. Look, listen and feel for breaths for no more than 10 seconds. If they are not breathing, begin CPR. Chest compressions, hand placement. Place the heel of one hand on the center of the chest, lower half of the breastbone, and the other hand on top, interlocking your fingers. Compression technique. Use your body weight to push down hard and fast at a rate of 100 to 120 compressions per minute. Compress the chest at least 2 inches deep, allowing it to fully recoil between compressions. Rescue breaths optional. After 30 compressions, if you are trained and feel comfortable, give 2 rescue breaths. Pinch the nose shut, seal your lips around their mouth, and breathe into their mouth until you see the chest rise. Each breath should take about 1 second. Alternate between 30 chest compressions and 2 rescue breaths. Continue CPR. Keep performing CPR until emergency personnel arrive or the person shows signs of life, such as breathing or movement. Key points. Stay calm. Your composure is essential for effective CPR. Focus on compressions. If you're untrained, remember that hands-only CPR, compressions only without rescue breaths, is effective and encouraged. Call for help. Always ensure that emergency services are on their way. These techniques are not just for medical professionals. Anyone can learn these skills. Whether you're a parent, teacher, or simply a concerned individual, knowing how to respond to choking emergencies can empower you to potentially save a life. Every moment counts, and your actions could be the difference between life and death. Let's commit to being prepared and helping those in need. Thank you for joining us today to learn these essential life-saving techniques. Remember, being prepared and knowing how to respond to choking emergencies can make a significant difference in critical situations.